I'm Dr. Stan Bratton, Executive Director of the Network of Religious Communities, and I thank you for joining us on this edition of In Process, a continuing discussion of significant issues and events affecting our lives, the lives of our congregations, and our community. For more than 100 years, leaders of both political parties struggled to bring affordable health care to all Americans. There were some successes along the way. In 1965, Congress created Medicare and Medicaid. These were significant achievements. However, many who were not covered continued to find health care unaffordable. To the surprise of many, Congress passed and President Obama signed into law the Affordable Care Act on March 23, 2010. In spite of a rocky start, numerous attempts to rescind the law, and the surviving of a Supreme Court challenge, the Affordable Care Act is achieving its goals. 5 years after its passage, the number of uninsured Americans has dropped by 16.4 million. Healthcare costs have grown at their lowest level in 52 years, and exchanges are working. The greatest benefactors have been minorities, young adults, and those who had been denied health insurance due to previously existing conditions. Now comes another challenge to the law. The Supreme Court has agreed to hear a new case, King versus Burwell, which challenges the validity of the IRS rules that makes tax subsidies available to those who qualify, whether the federal government or the state set up the exchange. The potential impact of the decision by the Supreme Court is immense. If the Supreme Court agrees with the challengers, more than 7 million people who bought their insurance in the 34 states where the federal government set up the marketplace will lose their tax subsidies. The market for affordable individual health insurance will collapse in the face of shrinking numbers of insured people and skyrocketing premiums. More than 24 organizations have filed friend of the courts briefs on behalf of the government's defense of Affordable Care Act, including the American Cancer Society, the Catholic Health Association of the United States, and Catholic Charities of the United States. It is not our intention on In Process to argue the case being heard before the Supreme Court within the next month. We want to instead understand what is at stake in the impending decisions and what it could mean for those in need of affordable health care in our nation and here in Western New York. To talk with us about the importance of affordable health care in Western New York and the friend of the brief court filing by Catholic Charities, we have invited the COO of Catholic Charities and the Central Intake Supervisor of Catholic Charities. We will also take the opportunity to learn about some of the amazing work being done by Catholic Charities in our own community. I'm very pleased to welcome Tish Brady, who is the COO of Catholic Charities, and I'm also pleased to welcome Renee Siepierski, the Central Intake Supervisor for Catholic Charities. Welcome, both of you.
Thank you.
Thank you so much.
Well, Ray, I want to go right to you at the beginning and talk about the brief that was filed by Catholic Charities. Can you say a little bit about it? I know you're not an attorney.
That's right, Stan.
Right? But it is a significant filing.
Oh, absolutely. And I want to thank you for really bringing this attention, the kind of attention to this particular issue to the greater community. That's really terrific. Catholic Charities, of course, we have Catholic Charities programs and operations all over the United States.
Right.
So when Catholic Charities USA really makes a statement about what's important, it does really reflect our Catholic tradition, our Catholic values. For example, a real fundamental piece of our Catholic social tradition and Catholic social justice and teachings really is, you know, the respect for individuals and the respect for all of us. And a big piece of respect is access to what really every one of us really should have to have a good life, have access to, and that's health care. So Catholic Charities has been very active about this. They are very, very strong supporters of the Affordable Health Care Act. And the subsidy issue that you bring up is so close and critical to us because of the folks who come to our door for help. And I think when we think about it, you know, I know we talked about who really has benefited from the Affordable Health Care Act. And it's everyone from, you know, really the youngest of us, you know, to folks who are really in transition in their life. And I just want to share really two examples really quickly. There was a young man who came to us. He was kind of in the cusp of his life. He's starting off his career. He had a couple part-time jobs really strung together, lost his main job, and really had no health care at all. He was able to go on the exchange. He was making very, very little money. But it allowed him in that period of time between his, you know, being unemployed and not really having access to anything at all, to really ensure that his basic health needs were taken care of. And as all of us know, really access to preventive health is foundational for every single one of us. And then I'll kind of share another example. And this is a woman who also I've come to know. And she's 57 years old. She had been working in the food industry business. She lost her job. She did have health care. She didn't have to worry about those kinds of things. She was able to go on the exchange. And again, both of these individuals really could be able to take advantage of the subsidies. She was able to go on the exchange, secure health insurance, and in this period of her life, really take care of, you know, some of the things as we mature, you know, we may be facing, which is hypertension or any one of those health factors that we very often hear about in our community. So it really is about benefiting all. And I think that's what's so critical. And I think when an agency and an organization like Catholic Charities USA does file this kind of, you know, friend of the court brief, it speaks for all of us. And I think, you know, having strong communities is about taking care of every member of the community.
Well, as I read the brief, I saw 2 points that really stand out. One, again, is the importance of the subsidies.
Oh, yes.
And the other is the immense harm that has occurred should this be overturned.
Oh, absolutely. And I think, you know, at Catholic Charities, there's so many folks that we see throughout Western New York. These are folks who come to us in their time of need. And when you hear their stories and you understand their life circumstances and how quickly their life circumstances can change, you know, you see the value of really resources that families can tap into, you know, such as the Affordable Health Care Act, ensuring that they have health insurance.
And if you lose your job,
you lose your job,
you have enough to worry about. And now all of a sudden
do.
you're saying, I have no health insurance.
I have no health insurance.
And particularly if particularly with medications, that I have essential medication, how do I pay for them?
Absolutely.
And it becomes a downward spiral.
It does.
Well, I want to take a moment now after we've done this just to introduce each of you. Renee, COO, Chief Operating Officer for Catholic Charities. Are you originally from Western New York?
Well, we chatted a little bit before. I'm actually from Pennsylvania, and you know, spent some early years in Pennsylvania. But my education and my career has been entirely in Western New York.
Well, what kind of education did you have that, you know?
Well,
in
actually,
preparation for
I
this?
have a master's degree in social work, and it's certainly a fit for the kind of work that we do at Catholic Charities. So I've had the pleasure, really, of serving this community for 15 years at Catholic Charities, and in this particular position a couple years now. And you know, in this role as the Chief Operating Officer, one of the things that I really get excited about is the opportunity to see every single solitary program and service in action in this community. So it's a wonderful opportunity to appreciate the great team we have at Catholic Charities, and really also the wonderful people of Western New York who support the work that we do.
And Renee Siepierski, you are the supervisor for the intake
Yes,
at
I
the
am.
central office of Catholic Charities. Are you from Western New York originally?
Born and raised in Western New York. Went to Hilbert College for my undergrad and for grad school. I was actually in their first cohort for their grad program.
First cohort.
Right, so for their grad program, I have Master's in Public Administration, and you go through the program in a little group, and they call it a cohort.
Right.
So there's a group of 8 of us, so we started the program together, went through it together, finished it together, and we were the first ones, so it was a really wonderful opportunity to be part of that. My husband's from Western New York. We plan on staying here, raising our children here, so
What
stuck with
led
me.
you to Catholic Charities?
I had done some work with Catholic Charities in previous positions in the community, and I always had such a wonderful experience with them. And they do so many things in all 8 counties of Western New York, and it was something I really wanted to be a part of.
Okay, let's talk a little bit about Catholic Charities. I mean, we see it at the birth message on television. You know, we know you do a number of things, but what is Catholic Charities?
Oh, Catholic Charities is so many things to so many people. I'd like to talk a little bit very broadly about programs and services. We have a department called Family and Community Services, and it's exactly what it sounds like. And actually, Renee is a part of that team. And the really idea behind it, the programs and services, is that it's very centered on children, it's centered on families, and the goal of all of the programs and services in that configuration is sustaining and supporting families in their communities.
Well, we do have some photos
Oh, great.
that you might comment on.
Oh,
I know
terrific.
that we began with some of the work with children, and that's employment education, I believe.
Absolutely, employment education. And when we think about employment education, it's just fundamental to really the needs of families. So really what you're looking at right now is the assistance that one of our team members is really giving someone who's looking for a job. And of course, you know, the world has changed over these years, and most of the access when folks are looking for jobs really is online. So that's a skill as you're looking that you really need to, you know, make sure that you're getting stronger in. And this particular photo, this is about, you know, our younger folks who maybe have not been successful for a number of different reasons in school. Here they're working on their degrees, and that's very exciting because this is really having a high school equivalency diploma or a high school degree is essential to any entry into any job. So.
And another photo was,
Oh, I love that photo.
That's the
yes,
refugee celebration.
it's absolutely it is. We have a significant refugee program. We're always excited about welcoming new Americans, new potential Americans into this community. Last year there was I think we settled 600 individuals who really come to this country, as many of our ancestors did, in really hopes of, you know, living in a safe world. All of these folks really have really led very challenging lives before they actually arrived here. Now, this is an example of a training program that we do right now within our refugee program. And you can see a sewing machine there. And you can see that that particular individual, we have a whole group, we have a wonderful collaborative with Canisius College where their volunteers work with our staff and our individuals to give them job skills. And yet so many of these folks come into this country having job skills already, but it's really about the language and about retraining and the work that we do in actually helping people find jobs.
And I think we still have another, and
We do. Oh, this is,
Seniors.
yes, wonderful services for seniors. Certainly this is a population that's growing. We hear every day that 10,000 folks actually kind of move into the category of being a senior. And I think what you see right here is you see a program. It's called A Gathering Place, and this is for really individuals who want to stay in their own home, but really need the supports to really create a full day of activities, of socializing,
I think we have a
of
photo
being
of
with
that.
other folks.
Maybe one other photo.
Maybe one
here.
other.
Oh,
Oh, I can switch on this one now. This particular photo is about a class that we do, And this class is ongoing in every one of the counties in Western New York. And it's called OK Peeps. And it's really for couples who have separated or who have divorced, a way of really focusing on the needs of their children. And so it's a 3-part class, you know, that our adults, our parents are coming in, and they're really learning about ways in which they can kind of take apart, you know, some of the anger and hurt that they have and really focus on the needs of their children. And we're always excited about that. Oh, and here's our friend. This is a great picture of a day in the park. We have a WIC program, and Women, Infants, and Children's nutritional program in Erie County and Niagara County. And we are serving about 22,000 individuals. Wow. It's a, you know, so we are touching lives of young families who, again, they're just moving into the marketplace. They're having their first child, their second child, and we do so much work with these families. But this particular event is our breastfeeding walk. And one of the things that we're so excited about at Catholic Charities is we have one of the highest incidents of our moms, you know, really wanting to take care of the nutritional needs of their children, give their babies a great start, and our staff really supports, you know, breastfeeding as a nutritional option. Here we are back again. This would be our senior socialization program. And you can see that the group right now is working on an activity. And again, anything that we do really starts with the person and whoever they are and what stage of their life they're in. What are you interested in and how can we support it?
Well, and again, you do.
That's right, an exercise program.
But Catholic Charities serves anyone, not
Absolutely.
just Catholics.
Oh, no. In fact, the majority of individuals that we serve at Catholic Charities are from any other denomination. And Catholic Charities is a place that you can come home to. We'll be there when you need when you need us in various stages of your life.
Well, Renee, what are some of the needs of people that come to Catholic Charities? You're involved in Intake.
So Central Intake's really a unique program because we take walk-in clients for emergency assistance. They don't need to call ahead, they don't need to make an appointment, they can come in. Regardless of the need, we're going to meet with them. We're going to do a full assessment to figure out what is the need that brought you in today, but maybe what are some of the other needs, looking at the big picture for this family or individual. The most basic number one need that we see is food. People that are using their earned income or their SNAP benefits but can't seem to stretch it out the entire month. Or they had an emergency, their fridge broke, they lost all their food, they had a robbery, a burglary, number of different things. The other needs that we see, clothing, prescription assistance, housing assistance, dental needs, you know, you name it. I mean, we see it on a daily basis. Domestic violence victims, fire victims, and we have amazing social workers that are in Central Intake, and they'll spend as much time as they need with each client.
So someone walks in the door to Catholic Charities. What are the steps they go through there?
So they come in the door, they go up to the receptionist. The receptionist gives them what we call a welcome form, just to get some basic information and try to find out what brought them into our office today. Then they're given a number, they're called by their number because we're very big on confidentiality. And then they go in and they meet with one of the social workers and to begin that assessment process. And again, we try to get some information from the clients, but we don't ever force them or make them tell us, you know, whatever information they want to share, we're there to listen.
Now, in your experience, again, dealing with Intake, how important is having health care to the lives of the people you deal with?
I mean, we, on a daily basis, see that it's saving lives. We have just a significant number of clients that have come in, and we saw 8,000 walk-in clients in our program alone last year that have had their lives saved because of the health insurance they were able to get through the exchange. Clients that did not know that they had cancer until they were able to go to the doctor, and that is true. It's just absolutely amazing. And some of these clients haven't had health insurance since they were a child, never in their adult life. they had access to health insurance.
I run into people that talk about, again, they have never been to a dentist or
Never.
since
Never.
they were a child.
No.
And are able then to begin to again, get fillings or a very bad teeth filled and so forth.
And tooth pain is one of the worst things I think you can go through. And imagine, having different issues that you're dealing with in your life, but every day you have this weigh and to make it that much harder for these individuals that are facing these struggles, it's something that I can't even imagine. So we've seen just a huge amount of positive things come out of the health exchange.
And I think I would like to add a little bit about our Apollonia Guild. And this is an amazing group of dentists right here in our community who volunteer their services. So
they're
an individual
great.
would actually go into central intake. They would have a conversation with one of Renee's social workers. We would understand that pain that they've been suffering. We have the opportunity to find a dentist, a volunteer dentist in the community who's willing to really, really respond. Okay, let's get the person in there, let's get them in the chair right now, and let's do the emergency work that they need to have done. So we have such a great deal of gratitude for these, so giving men and women.
Well, some people would say, well, you see, there are volunteers. There are volunteer dentists, there are volunteer doctors. We have some amazing clinics here in Western New York. Well, then why do we need health care?
Oh, well, I think I was just talking about emergency.
Okay.
So that this would not be ongoing care. This would be, you have an abscess today. We're going to get you in the chair tomorrow. But then there's the ongoing kinds of care that you need. Are there some resources in the community where there's a walk-in clinic? Sure. Do we refer folks who have, really, really emergency type needs? Absolutely. But that doesn't take care of the routine health care that the three of us have access to because of who we are, because of being employed, because being a part of a healthcare plan through our jobs. That's we are fortunate in that way, but there are so many others who really, as Renee said, they've never had those opportunities. What do you do first? When your family's hungry, what's your first need? You're going to make sure that basic need is met.
Right.
Right?
So we really look as, in some ways, Catholic Charities is be able to meet all kinds of different needs or make the referrals. One stop to come there first.
Yes.
And I know Catholic Charities makes many referrals to us. I mean, we have a food pantry, but we also do the food stamp work and around hunger advocacy as well.
We actually work very closely with your organization. Kellyanne, she is amazing. I've known Kellyanne many years now. We also do food stamp outreach through our office, and Kellyanne has been wonderful in training that worker and working together with her. So we're very thankful for your organization for all the support you've provided us.
Well, it's really good to see again the work that Catholic Charities does, and also to say how important healthcare is in the priorities of Catholic Charities.
Absolutely.
And that we really want to urge people again, whatever they can do to be able to continue this healthcare program.
Absolutely.
Now, how is Catholic Charities supported?
Oh, a number of ways. In the work that we do, of course, it's supported through the Erie County Department of Social Services, Erie County Department of Mental Health. Our WIC program, a big supporter, is the State Department of Health. So they're just a couple examples. So there's that governmental kind of funding. There's foundation funding. And really, the foundations in our community are very, very generous to human service agencies. So that's certainly a big piece of the funding. And then really wrapping all of that funding together and really making sure that we can respond to individual needs, special needs, not program needs, but the individual needs of families in the community is our Catholic Charities appeal. And of course, we're very grateful to the tremendous support from the folks in Western New York. So it's individuals really in our Catholic parishes. It's individuals from all faiths who really contribute to this. Corporations, businesses. So there's really a wide berth of support for the work that we do.
What's the name of this year's campaign?
Find good within.
Find good within.
Find good within. And it's not only find good within, but when you look closely, Stan, you can almost see find God within. So it certainly represents, who we are at Catholic Charities, what our desire is. It's a very big goal. It's $10.8 million.
Wow.
It's very big, but the needs are very big in the community. And, our work is really to get the message out there, not only to provide the service, but really get the message out to the community that it takes all of us to make sure that we're meeting every single solitary person's needs in the community.
Now, how do they get in touch with you?
It's not hard. Our telephone number is area code 716-218-1400. That actually, we have that particular individual, when those calls come in, they begin really kind of triaging and really give everyone the exact number that they're going to want to call for help.
And you have a website, ccwny.org. CC, which is Catholic Charities.
Right.
WNY, Western New York. .org.
.org.
Well, I want to thank you for being here, but I just want to circle back once again.
Sure.
We're talking about the brief that Catholic Charities serve, and again, why the Affordable Care Act is so important.
When we think about, and I know certainly Renee has, she is on the ground every day. We have constantly, when individuals come to us who are referred from hospitals or who are referred from other agencies, we have always worked to access any kind of health care support that we could for them. What's different about the Affordable Health Care Act, that anyone can apply who does not have health insurance, and they have an opportunity to secure health insurance.
Thank you
That's
very
the important
much.
piece.
Tish Brady, who's the COO of Catholic Charities, and Renee Siepierski, who is the Central Intake Supervisor. And I'm Dr. Stan Bratton, Executive Director of the Network of Religious Communities. I thank you for joining us on this edition of In Process. We'll be back next month with a new edition of the program. In the meantime, I hope to see you at your house of worship.